Fintech company HealthEquity is up in the pre-market after beating analysts' expectations on the top and bottom lines. It's a custodian for health savings accounts, and the company has its finger on the pulse of healthcare in America. Joining us now, first on Squawk Box, Scott Cutler, CEO of HealthEquity. It's his first TV interview since taking over the top job at the company on my birthday, and it's January 6th, right?
Absolutely.
Okay, I'll take it as a birthday present. Actually, shareholders are doing pretty well. Solid numbers that you reported this time. Stocks up, even in a market that maybe hasn't been, it's getting better, but it hasn't been that great. And what's in this new bill would be a boon for you.
We had a great start to the year, and I think it's just backed by growth in this industry. We're the leader in the space of health savings accounts, which is an industry that's grown from $10 billion to $135 billion over the last decade, and yet we have an affordability crisis for Americans in the United States. You know, 1 in 4 Americans cannot actually afford a $400 unexpected medical expense, and so we have this savings vehicle that helps prepare people for those types of events.
60 million Americans have one. I think CNBC, I think we have with your company. We have one. What does the new bill do? It could expand access to 20 million more Americans. How? By changing what?
So it's changing the eligibility of those that were previously excluded from the opportunity to
older
invest
Americans
in HSAs. So Medicare A, which would be retirees that are entering into the market. If you had signed up for Medicare Advantage and you had an employer-sponsored plan, you could not contribute to an HSA. So that was one area of expansion. Other areas of expansion provided more flexibility for people to use, for example, in preventative wellness opportunities, to be able to use your HSA dollars, for example, in a gym membership or for a primary care doctor.
Gym memberships.
Yeah.
That's new.
Yeah.
Look, I have to say my biggest problem with HSAs in general, and this has been a while for me, is just how complicated it is to get reimbursed. It's your money that you've set aside, and the hurdles you have to jump through make it pretty complicated. Can you make that easier?
So we're really trying to prepare Americans to be able to save, invest, and to spend. And what previously was the challenge is that a lot of those reimbursements came through paper-based processes, forms. Now
when you're sick, by the way, trying to get reimbursed when you are already sick or you've just had a baby or something along those lines, it's pretty complicated. The reason I've never put any money in an HSA again was because of some of the paperwork, the red tape, while I was on maternity leave.
And now you can take a picture of that receipt on your phone. We'll process that automatically, reimburse that instantaneously. It's seamlessly integrated into your digital wallet, Apple Pay. Use it on a marketplace like Amazon for HSA qualified expenditures. So we're trying to make that process seamless to, again, help people prepare for their medical and health expenditures.
I mean, articles point out how attractive it is in terms of tax breaks if you use it properly, almost to the extent that it could become as common as a 401k or as useful as a 401k. Why aren't you hearing any backlash from in this bill that there's too many tax breaks here for HSA accounts?
Well, the regulatory regime for HSAs has been around for a couple of decades, and it's the most tax-efficient savings vehicle for healthcare. And so how it works is that you can contribute pre-tax, it can grow tax-free, just like a 401k, and then you have to spend it on healthcare-related expenditures.
Not right away, though.
Yeah,
right.
It can grow over time.
But you could even incur costs and not even take it out till years later.
As long as you have proof of a receipt for a medical expenditure. And so it's very tax efficient.
It's not just a medical procedure. It's also that it has to be for a mandatory nature. And that's where I got into trouble with them. They were arguing back and forth about me about whether I needed some of these medical procedures. And when you're sick, it's really hard to deal with that.
Yeah, it's frustrating when you're denied coverage. But again, I think what we're trying to prepare for is just the reality for retirees as an example, which is a big part of this legislative expansion. A retiree couple needs about $400,000 in savings for healthcare-related expenditures, and 1 in 5 are going to outlive their savings. And so you need actually a vehicle to help prepare for that. And then, obviously, to your point, seamlessly integrated when you want to, when you need it.
Right.
Well, get some good AI type help on this, and you ought to be able to streamline it.
He's got some of it. And I guess that's the other frustration. Like, AI would be great if you can process things more quickly and get it there. But if I get turned down by an AI agent instead of a person, I'm going to be even madder.
It's a delicate balance to make sure that we can deliver on our members' expectations and to be able to do that more efficiently. And AI,
can I talk to a person? Like, you can get the AI to do all the easy stuff and push it through quickly. If I have a problem with that, can I still talk to a person?
Absolutely. We still have phone-based support, but and we're really trying to, again, make that process that you're going through that's previously form-based and frustrating to be seamless, efficient, transparent, and again, help you at that point in time in real time. And that's where technology and automation can, vastly improve the consumer experience.
Has the IRS gotten more complicated? I know they did around 2011. That's when I had an issue with them, when they really tightened some of the hurdles you had to jump over. Has it gotten easier since then?
It is, and the burden is on the taxpayer to show that the expenditure was related to health care.
Can I just tell you, you said January 6th is your birthday, so I'll show some personal stuff, too. They questioned whether my episiotomy was for cosmetic purposes.
Oh, my God.
That's why I've never put another dime.
Saying the Insurrection Day is my birthday is a long way from what you just said.
But
okay?
I would just say
I did not open I'm not taking the rap for this. I did not open the floodgates for that.
But that is my problem with it. Like, the idea that when I was sick and trying to keep a new baby alive, to be arguing with them about some ridiculous, stupid questions like that and not be able to get my money that I had set aside for this. That's why I have been turned off to HSAs ever since. Has it gotten better?
Well, there's also a difference between HSAs and FSAs. So FSAs would be a use it or lose it type of vehicle, which we also administer. An HSA, again, we have all of our platform integrated with the plan and the providers. And so, again, when you go to a procedure, when you have a healthcare expense, it's integrated into our platform and it's seamlessly and in real time
wasn't a planned procedure.
Reimbursed.
That's an on-the-moment procedure, which happens a lot.
Yeah.
There's a lot more we could talk about because we've got, this is just another part of our very complex and interconnected healthcare system in this country. And is there fraud? Does this help prevent fraud? Does it help hold down costs? These are all things we need to, look at this whole bill. It's all about Medicaid and Medicare and everything else.
We have to remember that we do have an affordability crisis in America. So healthcare is increasingly out of touch for most Americans.
Right.
And we need things to be able to help them prepare for those events.
Right.
And what we believe is that we have this opportunity, despite things that you're talking about, to really help educate Americans on this opportunity, but also to be prepared for these unexpected events that we all have in our lives, and to make sure that we're thinking about an HSA as an example, much like you would as a 401k, that you're preparing for retirement, in this case, preparing for a future healthcare need or medical crisis.
It makes sense. It is the proper way to plan for things. And if you can make it easier, particularly with AI, that would be great.
Yeah.